Hello, this is Dr. David Hudson doing your virtual online lecture for NUR 391, Hygiene, Restraints, and Safety. This lecture will be broken up into multiple small bites so that it can be recorded appropriately and viewed as you need to. It is important that you start with Module 1 and move through them in the correct order. So let's get started with hygiene and safety. So our objectives here come from chapters 23, 24, and 25 related to promoting asepsis and infection, facilitating hygiene, and promoting safety, specifically with restraints. We're going to talk about medical asepsis, hand washing, restraints, and just hygiene in general through the next few modules. So chapter 23 talks about promoting asepsis and preventing infection. So first of all, we need to look at what these terms mean. Asepsis is a term that means the absence of contamination by disease-causing microorganisms, which means you have a surface or a place that doesn't have any disease-causing organisms. As you know, that's pretty near impossible to achieve. The closest we come would be the operating room suite, where you have tables and space that are completely sterile, i.e. the sterile field where they're doing the surgical procedure, and the tables in and around that surgical procedure that hold the supplies that are sterile. Medical asepsis, on the other hand, is a quote-unquote clean technique that has to do with the way we decrease the potential for spreading of infections. It involves hand washing. As you'll learn, hand washing is everything in healthcare, and overall environmental cleanliness. So most facilities have approved solutions that they use for cleaning, and they follow recommendations from the CDC and other places that are usually a 60% alcohol-based solution, and they go anywhere from rubs and sprays and gels and foams. In the bottom corner of your screen, you see a Purell hand sanitizer. That is 60% alcohol. Some of those spray stuff out. Sometimes it's a gel, sometimes it's a foam. You just put it on your hands and rub it together. You're all familiar with the concept. We do it every day. Then we also have antimicrobial soaps that we need water with when our hands are visibly dirty. So there's one important thing you need to understand specifically with C. difficile, which is usually seen in the GI tract. It's when an individual has this type of infection, only a microbial soap or an antimicrobial soap, or a bleach-based product removes the bacteria. So if you get it on your hands, you need to make sure that or your body, you need to make sure that you're using an antimicrobial soap. If it's on a surface or clothing, etc., you need to make sure that you're using a bleach-based product because alcohol is not strong enough to remove it. Do not clean your hands with the bleach-based product that can cause problems, okay? So the CDC, or the Centers for Disease Control, has standardized precautions that we use, and there are two tiers. The first tier applies to everybody, and they're basic standard precautions. And essentially what this means is we treat everybody as though they could give us or transmit something to us. Traditionally, it's usually just contact, so we might wear gloves or something like that. But they could have an underlying respiratory thing that we might know about, and you simply use a simple mask. But tier 2 is when we're dealing with patients that we or clients that we know or strongly suspect are infected or have a colonized infectious agent on board. Excuse me. And we base these precautions based on the mode of transmission. Contact, meaning we don't want to touch the skin or the patient themselves. Droplet, meaning the moisture that's going through the air when the patient breathes or coughs, or just air in general. And then there's body fluid, urine, blood, fecal material, so forth and so on. Talks here about a respirator or an N95 mask. Those are high-level airway protection. You have to be fit tested and so much for those. Basic PPE or personal protective equipment is what we use for standard precautions and transmission precautions. What you use depends on the source and the location of the suspected infection. Hand washing, hand hygiene is top priority. That's your number one defense outside of your skin. Gloves, gowns, face mask, eye protection, or a face shield can also be used. May want to cover your shoes with booties or whatnot, especially if there's a lot of body fluid around. And this can go up to include those space suits that we often see in the OR or on TV or wherever. Excuse me. So this slide, or this has three photos that look at different types of PPE. In the top left, you have a general assortment of basic level personal protective equipment. You have a yellow biohazard bag. Most of the time they're red, and that's what you put any kind of contaminated stuff in, whether it's PPE that's been contaminated or whether it's dirty gauze or tissue or whatever, and it would go in those. So in this film or that picture, you see goggles in the corner right below that, a higher level mask, and you see gloves and you see booties for your feet. But you also see a plastic impermeable gown. That means that nothing will go through it, and gloves. Then in the far corner on the top, you see a young man who is a caregiver for, or maybe even a visitor for this young lady who is playing the role of our patient. Um, just looking at him tells me that the person is on contact and maybe airborne or droplet precautions because he has on gloves and a gown. The gown is semi-permeable or not permeable. The fluid doesn't go back and forth through it. So that when he touches her, he's not touching her himself. He's using a barrier. And the mask in case she is exposing him to anything through her breath, sneezes, coughs, so forth and so on. She's probably on not on fluid precautions because he doesn't have goggles on. Okay. The bottom left picture is a little deceiving because the first thing you think about is, wow, they've got on a lot of stuff, and they do. They both have on headgear to cover their hair. They both have on some kind of face shield to cover their eyes. They both have on a mask. They both have on what looks to be sterile gowns and sterile gloves because of the way the gloves are put on. But if they're trying to portray a sterile field, they've broken a couple of cardinal rules. The first is the shorter individual has his or her arm wrapped around or behind the taller individual. We don't do that. When we're trying to maintain a sterile field, we separate. We don't get that close to each other. Okay. And everything in front of us is considered sterile. When it goes outside of our side of vision, it is no longer considered sterile or clean. Okay. So I'm assuming it's a her. Her hand that's behind him is no longer clean or sterile. The other thing is their hands are out and away from their body. When we have on sterile gowns, sterile gloves, and we want to be in part of that aseptic corner of the world, we tend to hold our hands closer to the center of our body and the center of our chest. And oftentimes you'll see people clasp their hands as though they're praying. What that tends to do is keep the hands close to the body so that they don't reach out to touch anything or something doesn't inadvertently touch the hands in the sterile field. This is a placard from the CDC that talks about donning or putting on PPE or doffing, D-O-F-F-I-N-G, taking off PPE. It's pretty standard procedure. You'll see variations of this in hospitals, textbooks, and so forth around. Follow what's in your textbook so that you'll know that for sure. Okay.